Welcome to Thursday's edition of COVID-19. I'm Min San Hee. The daily tally has risen higher today as nearly 500,000 test takers sit the National College entrance examination at over 1,000 test centres nationwide. And we are poised to visit one such test site in a little while. But first, here is our Hyunsuwa with the latest numbers on the pandemic. Now, so I hear we are still hovering in the 500s here in Korea.
Yes, Sunny, we are. And we also have another uptick by almost 30 cases. 540 infections were reported this Thursday, with new infections breaking out at a cram school, at a home shopping company, as well as a call center, just to name a few here in the capital, Seoul. And that brings Korea's total caseload to 35,703. We also have 3 additional fatalities, raising the death toll to 529. And also over 6,800 people in quarantine, with 117 of those being in serious or critical condition. That's up by 16 compared to yesterday. Now, since late November, we have been seeing daily cases in the 400s and 500s. And here we see that we also have domestic cases above 500 this Thursday. Now, let's take a look at our graph here. 500s and 400s, as I said. And with that, the daily average is hovering between 400 and 500, which means that meets the criteria for level 2.5 social distancing measures. We are currently at level 2. We see here 492.6 is the average daily cases between November 27th and December 3rd.
I see. So authorities are also urging for extra public vigilance today amid the college entrance examination.
Yes, Sunny, that's correct. It's an unprecedented college entrance exam for test takers today. Unprecedented in many ways. It's the first one to be held in December and with the lowest number of test takers, however, with the highest number of test sites. 1,383 to be exact. That's almost 200 more compared to last year, as well as over 31,000 test rooms. Last year, we had around 21,000 test rooms. So why that? Of course, to keep the examinees as safe as possible from possible COVID-19 transmissions. We will get a glimpse of how the tests are unfolding in a bit with our Jessica Lee on site. But before that, let's take a look at our map now. The tests are being held at 86 different districts across the nation under strict antivirus measures. As for the past 3 days, all 17 provinces and major cities have been affected by new COVID-19 infections. We have triple digits here in the capital, Seoul and Gyeonggi-do province, and also double digits in 6 other places as well. And we also have overseas cases today, with most cases from the U.S., 9 from the U.S., followed by 5 from Russia and 2 from Italy, which are countries that are in the top 10 with highest numbers of infections. 14.3 million in the U.S., 2.3 million in Russia, and Italy 1.6 million. In the meantime, Poland has become the 13th country to exceed the 1 million mark in total infections. And now let's take a look at some serious increases over the past day. The U.S. has again surpassed 200,000 in cases, in daily cases that is, and also exponential surges here in Turkey, with almost 32,000 new infections reported in just a day, surpassing 700,000 in total. And now the entire world has over 646,000 new infections, also with almost 13,000 fatalities. And those are the numbers I have for now, but I'll be back with more updates after the government briefing. Back to you, Sunny.
All right, so thank you for now. Right, the National College entrance examination is well underway here in Korea, with close to 500,000 test takers at more than 1,000 testing sites nationwide, including those that have been set up for people who've come to contact with COVID-19. In fact, for a glimpse of one such test site, like I said earlier, I have our Jessica Lee up next. Hello, Jessica.
Good afternoon, Sunny.
Jessica, do start by telling us exactly where you are.
Yes, I'm reporting live from Seoul Youth Hostel in Junggu District, where the National College Entrance Exam, which is also called Sunung, is being held. So today, I'll be introducing you how COVID-19 has changed the test-taking environment. And this is a treatment center that provides life support and treatment services for COVID-19 patients who have mild symptoms. However, as you can see here, today this place is used as the test site for those who are infected but having mild symptoms. And the severe COVID-19 patients are taking the exam in negative pressure isolation room at Seoul Medical Center. Like this, for the safety of all test takers, those who are in quarantine or have mild symptoms are taking the exam in designated testing centers. And those who are infected and have severe symptoms are taking it in hospitals. And a cold snap happens to strike on the day of Sunung almost every year. This year, today is no exception as temperatures drop to -2 degrees Celsius. No wonder though, because the test has been postponed to December and the wind chills are making it feel even colder. And today from 8:40, the students are taking the exam, and right now, test takers are taking English exam. As they go in this morning, they had to get their temperatures and the symptoms checked, and they also had to sanitize their hands. This year, almost 500,000 students are taking the exam. The number is actually relatively lower than last year. However, testing sites are increased 1.5 times. And there was a teacher in Daejeon Metropolitan City who were about to be a proctor who tested positive for the virus on Wednesday. Therefore, a total of 19 proctors who had possibly been exposed to the patient were replaced today. And moreover, desks this year are spaced further apart than last year. They are reduced to 24 desks in one classroom from 28 last year. Not only this, but all test takers have to wear a face mask at all times except eating lunch and having their ID checked. Moreover, plastic dividers are installed around their desk to prevent the spread of droplet transmission. And if symptoms appear during the exam, a siren will go off from a thermal imaging camera that's working at all times. And the test taker who shows symptoms such as fever, they will be sent to isolated secondary examination rooms, and then they're going to be sent again to the separate testing places. Meanwhile, as a means to prevent the spread of the virus preemptively, the proctors and others participating in the exam can get tested at a temporary testing center for free. As you might have noticed, education authorities are putting a lot of efforts and taking extra precautionary measures for making this environment safely for our students. And until 5:40, when the tests are done, I hope all students not only to get the best score possible, but also to get safely through the test. This has been Jessica Lee reporting live from Seoul Youth Hostel, and back to you, Study, in the studio.
All right, Jessica, thank you very much for that coverage. Right, it's time now for the regular briefing on COVID-19 for this Thursday. Also, a reminder to our viewers here, the Greater Seoul area, which is already under level 2 social distancing, has a few additional restrictions in place until the 7th of December. In fact, let's take a look at the toughened measures on facilities and activities in the metropolitan region amid concerns over aerosol transmissions. Saunas and indoor sports facilities that offer high-intensity workouts are banned. Now, these include kickboxing, aerobics, and other similar vigorous activities. Also, singing lessons, as well as those for wind instruments, are forbidden, with exceptions for those preparing for next year's college entrance. All apartment amenities, including fitness centers, cafes, and libraries, are closed. Separately, authorities have also called for the cancellation of all end-of-year parties at hotels and other such venues. Members of the public are also being asked to refrain from social gatherings of more than 10 people. Up on the screen now are the rest of the guidelines under Level 2. Gatherings of more than 100 people are banned. Such large-scale gatherings include weddings and funerals. The briefing is about to start. We'll come back to you afterwards with a summary of it.
설명드리겠습니다. 코로나19 감염증
Let us now begin our regular
상황을
briefing on the
말씀드리겠습니다.
COVID-19 situation here in South Korea.
12월 3일 기준으로
As of December
국내
3rd,
발생
today
신규
midnight, we
확진자는
have a total of 516 new local infections,
해외 유입 사례는
and a total of
24명이
24
확인되어
new imported cases have been
현재까지
reported.
총
The total
누적
caseload now
확진자
stands at 35,703.
현재는
Currently, we have 6,822 people remaining in quarantine undergoing treatment, and there are 117 patients with severe or critical conditions. And as of yesterday, we had 3 additional fatalities. The accumulated death toll now stands at 529. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now go over the major updates of our domestic infections. Starting from Seoul's Dongdaemun-gu District Hospital, we have the first index case being confirmed on the 30th of November, and we have identified 21 additional patients, and the total now stands at 22. And in relation to an university band group in Seoul's Songbuk-gu district, we also have the first case identified on the 1st of December, and we have 17 additional cases being confirmed, and in total, we have 18 cases being confirmed to date. And in Seoul's Gangnam-gu district, in relation to a call center, we have 5 additional patients being confirmed, and the total cases now stand at 14. And in Seoul's Jungnam-gu district, in relation to a second sports facility, we have 11 additional cases being confirmed. In total, we have 31 cases being confirmed to date. And in relation to a pub in Incheon Namdong-gu district, we also have the first index case identified earlier this month, and we have 16 additional patients being confirmed. In total, we have 17 cases being confirmed to date. And in Gyeonggi-do province, Bucheon City, in relation to a university hospital, we have the first index case being identified earlier last month, and we have 13 additional cases being confirmed. And in total, we have 14 cases confirmed to date. And in relation to a pub in Daejeon City, Yuseong-gu district, we have 9 additional cases, raising the total to 18. And in Jeonbuk, we have the Gunsan City apartment repair business. We have 2 additional cases being confirmed. In total, we have 12 cases being confirmed to date. And in relation to a religious facility in Busan Sasanggu district, we have 4 additional cases, raising the total to 36. And in Busan and Ulsan cities, we have Janggu lessons, and we have 6 additional cases being confirmed. In total, we have 164 cases being confirmed to date. And as for other cluster infections and information related to other cluster infections, please make your inquiry to the spokesperson's department after the briefing. Currently, when we look at the trends of the outbreak, we are seeing massive outbreak and massive increase in the number of confirmed cases in non-metropolitan regions as well. And we have the higher proportion of ages between 20 and 39 who has been hovering around 28%. However, this has increased to about 34%, meaning that we are seeing wide expansion of the business of the virus transmissions, and we are also witnessing many more younger generations being contracted with the virus. Currently, we have also seen intensified the social distancing measures, and we are also mitigating the rapid spread of the virus thanks to our toughened measures. But however, it is important for us to remember that a moment of complacency can lead to a massive outbreak, and we cannot let our guards down as of yet.
생각하지 못한
And
곳에서도
in
발생하기
fact,
때문입니다.
the virus transmissions happen at places that are unexpected. This means that we need to comply with the safety measures at any gatherings and at any time. For instance, we also have the kimchi making cluster infections, and there were also many reports of violations of the quarantine measures at such gatherings.
마스크의 필요성은
We need to once again highlight the importance of mask wearing. And in relation to an hospital in Gwangju City Seoggu District, we had 2 confirmed cases and also visited the hospital 3 times. However, they also wear face masks properly and they did not spread the virus to other people.
오늘은 대학 수능일입니다.
Today we have the nationwide college entrance exam 수능 being held nationwide, and we also like to note that many test takers also desire have the right to also get some words of comfort as they are going through the unprecedented 수능 exam this year. And once we also have one more advice to these test takers nationwide. We are seeing a prolonged outbreak of the COVID-19 not only in Korea but also in the rest of the world. This means that it is very important to comply with social distancing measures and quarantine measures. We understand that you have spent hard times studying and you want to also relieve your stress today after the exam. However, please note that the conditions and situation right now do not allow for such enjoyment. So please avoid getting crowded in cluster areas and also continue to comply with the quarantine measures. And please also exert our full efforts until the end of the college entrance exam procedures that will follow after the exam today so that we can ensure a safe environment for our students nationwide. And it is very important for us to get tested as soon as possible. So if you do not feel well, please do not hesitate, but visit a screening center as soon as possible. And there are many people who might be nervous and anxious about their suspicious symptoms, but we need to remember that you need to get tested in order to protect your loved ones and your friends. Moreover, for the sake of the safety of all the community, we need to also ensure that we need to have words of encouragement as well. Thank you very much.
오늘은 질의응답 시작 전에
Right, that was Lee Sang-won at the Central Disease Control Headquarters with Thursday's afternoon briefing. So, what did he have to say?
Well, first off, he had some updates on the recent cluster infections. There are new infections related to a hospital in the capital, Seoul, with 22 infections in total. Also, a university band group with 18 total infections, a call center also in Seoul with 14 total cases, and a sports facility which reported a total of 31 cases. That was only Seoul, but also many cases in other places like Incheon at a pub and in Bucheon, those in Gyeonggi-do province, also a university hospital there, and down in the southern part of the region at a religious facility in Busan, there is a total of 36 infections. And the current factors of concern are that these infections are spreading to all corners of the country, and the proportion of younger patients is rising. The number of patients between the 20s and the late 30s stood at 22% in October, around 29% in November, but this December, this proportion stood at around 32%. And that means we have many silent spreaders as well. And he also had a word for the test takers today who are taking the college entrance exam, some concerning words about the period after the exam, because many usually like to enjoy their time after having to study for all those years. So he asked them to not go to crowded places because this is really not the time to party.
Right. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, efforts to ensure public safety through innovative solutions continue even amid the pandemic. In this next report, we introduce you to a robot that monitors social distancing and much more at an outdoor park.
Hi, it's Shin Se-byuk. As the coronavirus emergency expanded to a full-blown pandemic, an army of robots has since been deployed everywhere. From helping frontline medical workers to making deliveries, now robots are everywhere.
As demand for contact-free services skyrockets due to COVID-19, robots are quickly becoming part of our daily lives.
원래 자율주행 로봇은 사람들이 가기 힘든 그런 위험한 곳이라든지 아니면 오늘처럼 이렇게 날씨가 춥거나 환경이 안 좋은 곳에서 작업을 수행하는 목적으로 많이 개발이 되었고 요구가 되어졌습니다. 그런데 최근에 코로나 사태 이후에 거기 하나 더 더해져서 사람과 이렇게 면대면 하지 않는 그런 비대면으로 일을 할 수 있기 때문에 코로나 이후에 이런 자율주행 로봇에 대한 수요가 매우 높아졌습니다.
According to the Korean Intellectual Property Office, the number of registered autonomous robot patents was 109 in 2019, a significant increase compared to 55 in 2016.
Today, I am at a park located in Daegu New Town of Siheung City. Today, I am here to show you something very unique about this park. Let me introduce you the security robot, Golly.
The design of the robot was inspired by the ice hockey goalie. One feature that distinguishes the security patrol robot from other ordinary indoor autonomous robots is that its primary purpose is crime prevention.
Unlike human police, Golly can patrol day and night 24/7. It is set to patrol designated routes within the park 3 times a week for the next 2 years until 2022. And pay attention to this upper part. It is a camera that serves as a set of human eyes.
The autonomous robot provides real-time 360 degrees monitoring of the park. And this allows the control tower to report any emergency situation to the police.
So I am inside the control tower right now, and you can look around what is going on outside using the camera that's embedded on top of the robot. It is already dark outside, but as you can see, the screen is so clear and vivid. That means you can respond immediately when emergencies happen.
근무하시는 분이 안 계시는 야간 시간대에 좀 그 활약을 할 수 있도록 그렇게 운영을 하고 있고요. 향후에는 이 카메라 자체에서 영상 인식을 해서 이상 사항들을 인식하고 자동적으로 이렇게 신호를 경찰서가 됐건 소방서가 됐건 이런 곳으로 보낼 수 있는 식으로 개발을 할 예정이고요.
The COVID-19 pandemic struck the world. With that, a new wave of robots has emerged to maintain safety and adapt to social and economic changes. From AI to self-driving, robots are evolving, and they are definitely helping people in so many ways. And now we have to wait and see what kind of new robots will be invented in coming years. This has been Shin Se-byuk.
The MHRA, the fiercely independent regulator, has clinically authorised from early next week we will start the programme of vaccinating people.
We could be seeing both of these vaccines out and getting into people's arms before Christmas.
현재 백신 개발과 확보, 접종, 그리고 집단 면역 확보를 위해서 세부적으로 노력하고 있습니다.
The front runners in the race for a COVID-19 vaccine have secured sufficient data to seek emergency use authorization, and the UK has become the first country in the West to grant such approval. For more, I have Dr. Anne Worthall from the International Vaccine Institute. Welcome back, Dr. Worthall.
Good afternoon.
And I also have Professor Sarah Ok Shin from Korea University. Pleasure to have you back, Professor Shin.
Thank you for having me.
Dr. Worthall, 3 vaccine candidates appear to be leading the race at the moment. We have Pfizer's with an efficacy rate of 95%, Moderna with 94%, and AstraZeneca's vaccine candidate has been found to be 70% effective in preventing COVID-19. What are your thoughts on the progress so far on the vaccine front?
So as you know, as of end of November, 11 vaccine candidates have reached this late stage of development, the phase 3. Including the leading ones with Pfizer, with AstraZeneca, as well as Moderna. And we have also seen the results of the protection level that is high, a protection which is highly positive. And the results also show that having a highly protective vaccine is possible, which is a first good news. Secondly, all of the 3 vaccine candidates have met their requirement from a regulatory standpoint to have at least a protection of 50%. That was the minimum requirement to get this vaccine license. So they all have met their primary objectives in terms of clinical trials. And there was another good news since yesterday. We just learned that MHRA, a UK regulatory agency, has granted a temporary use or emergency use for Pfizer vaccine, which is another good news. And remember, this is the first mRNA vaccine to be licensed by a very stringent regulatory agency. And it has been done within less than 12 months of development for such a vaccine, which is remarkable and unprecedented. So I expect that in the coming weeks or so, there will be 1 or 2 additional vaccines that will be licensed for emergency use. So all in all, I think we are optimistic to have the first vaccination implemented before the end of the year, targeting, of course, the primary, I would say, high-risk population first, with healthcare professionals, for instance, elderly population, or adults with comorbidities, those that are experiencing the most severe form of the disease. So we have good news before the end of the year.
Right, we'll keep our fingers crossed for that. Professor Shin, AstraZeneca's trial results, meanwhile, are receiving quite a bit of attention. I understand a dosing error caused some participants to get half a dose in their first shot and then a full dose. And these participants apparently saw an efficacy rate of 90%. But the group that had 2 full doses in both shots were only found to be 62% efficacy rate there. Hence, the average efficacy rate of about 70%. What are your thoughts on this finding?
So first, this is interim analysis and preliminary data. So more informations are needed to carefully analyze their data. But we can speculate a few things here in that given that these AstraZeneca vaccines were made with genetically modified adenovirus vector, which is harmless, but this might have led to the generation of antibodies against the virus vector, the harmless virus vector. So when you give a second shot, maybe the antibodies you made were able to get rid of that virus vector. So, but maybe with the half dose, less of that happened. So, but this is a speculation, and we need more additional results so that we can find out why the half dose was able to induce a more robust and better immune response.
Right. Dr. Worthall, could you tell us a bit about the technology used by the 3 companies in developing their vaccines and also about the merits of the respective approaches?
Right. Both Pfizer and Moderna are using mRNA technology. And they are given in 2-dose regimen for the primary series. And we know that for those vaccines, they need to be stored in a freezer temperature, meaning minus 70 degrees Celsius and minus 20 degrees Celsius for Pfizer and Moderna, respectively. And Moderna actually is part of the COVAX facility initiative, and the development has been funded by CEPI. The main advantage, I would say, of this technology is that it's relatively easy to scale up and manufacture the vaccine to get hundreds of millions of doses. For AstraZeneca vaccine, there is another technology that is called the adenovector technology or viral vector technology. And this type of vaccine will be stored in a refrigerated temperature between 2 to 8 degrees Celsius. That is the usual temperature range for any licensed vaccine in the world, so which is a strength on itself. Because when it comes to vaccine supply, vaccine transportation, and vaccine distribution, you need to have this temperature easily to be monitored in a refrigerator compared to the freezer, which is much more challenging somehow for the ground. We need to remember also that adenovector vaccine could conceivably be manufactured very quickly as well, and the production capacity can reach 2 billion doses with this type of technology. But there's no adenovector vaccine license yet as of today for use in human. So this one will be likely the first one from AstraZeneca to be licensed. And both platforms actually in terms of clinical trials data have shown that they can elicit a good immune response for protection. They can elicit neutralizing antibodies as well as T-cell response to provide protection to the vaccinees.
I see. Professor Shin, in contrast, what are some of the limitations of each of these vaccines?
So as Dr. Walter mentioned that, the mRNA vaccines made by Pfizer and Moderna have probably two major limitations. One is the stability and the other is the cost. So the mRNA vaccines require, ultra-sensitive temperature to maintain the stability. But AstraZeneca vaccines are more stable at 4 degrees, so it'll be easier to transport the AstraZeneca vaccines in developing countries as well. And in terms of the price, the AstraZeneca vaccines is about $3 to $4, and so it has a price advantage over the mRNA vaccines, will cost about $30 US dollars. So definitely AstraZeneca vaccines have the price advantage. But all three vaccines still lack the details on the long-term efficacy and as well as how well it'll produce immunity in all different age groups. So we probably know more about, we'll probably find out more about the side effects or long-term effects later on.
Right, and keeping that in mind, keeping what Professor Shin has just said in mind, Dr. Worthall, what are your thoughts on the safety of the current vaccine candidates?
Well, there are a lot of questions that remain unanswered at this point in time, right? Remember, all the data we have seen are based on the short-term window, 2 months after the last vaccination. That had shown a very high protection, which is great, but we don't know yet how long it will last in terms of protection, whether it will last for 6 months, 9 months, 12 months or so, we don't know yet. And I would say it's a matter of time. Time will tell, in the coming month for additional data to be released and to still be monitored. There's another question regarding the long-term safety, as pointed out by Professor Shin. That's something we don't know. As well, we have seen, the side effects, the common ones, in the clinical trial setting. But when you expand the vaccination to millions of people, you will see potentially rare events emerging. So just to say that it's good to have licensed vaccine to be used by public in the coming weeks or so. But we still need to monitor the safety profile, meaning that all the adverse events following immunization still need to be monitored by health authority to see any emerging safety signal when you use the vaccine. So there are questions that remain unanswered, but there are also some of those that have been partially answered already. For instance, whether the vaccine protects elderly population, which is shown already. That's a very good information because these are the targeted population at first. And then the second question is related to whether this vaccine can also protect different age groups, and 18 and above is very well protected as well. And the severe form of the disease has to be also tackled in terms of protection. And we have shown with the data that the severe cases can be prevented as well with those 3 vaccines, but we need more data.
Right.
Indeed.
And despite the fact that we need more data, the UK has approved Pfizer's vaccine and is poised to start inoculation, as shown in the video, as early as next week. Do you see this move as better tackling the resurgence there?
Well, I think we need to get into vaccination now, given the global need. But again, we need to be very cautious. Implementing vaccination has to be carefully tackled by the health authority to ensure, all the information has been provided, to ensure all the side effects will be collected properly. And then in the meantime, I would say public still needs to remain vigilant to keep all the safety measures, right? We cannot release all the safety measures overnight because the vaccine is licensed, because vaccination implementation or deployment will be gradually implemented at the country level. So it will take some time before we get back to our normalcy.
Right. Dr. Worthel, how long does it take for herd immunity to form in the presence of a vaccine?
Well, herd immunity has been mentioned quite early at the pandemic stage, saying that with a natural infection, we need to reach this level of 60–70% of the population being exposed to the virus, naturally exposed, to have this impact on the spread of the virus. Now, if you want to get it translated into vaccination that can also help with the herd immunity effect, if you will, then I think we need to reach that level of vaccination coverage, 60–70%, to start seeing this famous herd immunity or indirect protection. But I would say, even though we have the vaccine now licensed for use, we need to do additional studies in post-licensure with the effectiveness studies or herd immunity studies that really need to be put in place when you start deploying mass vaccination campaign. We shouldn't miss that opportunity to really detect and confirm herd immunity with novel COVID-19 vaccines.
So essentially there is still a lot of work ahead then?
I think so,
right.
But we're getting there.
Professor Shin, most countries appear to agree that healthcare workers at the front lines of the pandemic should be among the first to be inoculated. There is, however, little consensus after this group. There are some countries that say after that the elderly should be inoculated. There are other countries that insist that the actively working population, that is, should be the next in line. What is the plan here in Korea?
So vaccine supplies will be limited at first. So getting the shots to right people in the beginning is very important in terms of, changing the course of the pandemic. And many governments are, having plans, for having the priorities for vaccine distribution. And as you mentioned, the UK governments are going to start the mass vaccination as early as next week. And they're probably targeting these elderly groups because they are the most vulnerable and they're more likely to develop severe disease and death, right? So I think we can take the footsteps of UK government and we can take lessons from here. And our government is probably going to target the elderly groups as well as the frontline healthcare workers and the caregivers that work at nursing homes and facilities. So those groups, high-risk groups, should be the targets of vaccine distribution.
Right. Mm-hmm. Dr. Worthel, compared to its counterparts in the West, Korea is not rushing to procure vaccines. What are your thoughts on this rather cautious approach, should I say, to vaccine procurement by the government here?
Well, I understand that the Korean government has initially decided to providing vaccination to over 30 million people, right?
Right.
And lately, I think the government has also committed to increasing the number of people being vaccinated in the country up to 44 million, which represent 85% of the total population of Korea, and which is great, approach already. And I understand also that the vaccine supplies will be coming from overseas vaccines. So my understanding is that Korea government might have, in the portfolio of the COVID-19 vaccine, a combination of mRNA vaccine and viral vector vaccine to be able to have sufficient number of doses for Korean population. So which is great, and I understand that there's a need to have additional budget that the government had committed to raise for next year's state budget to have $1 billion, over $1 billion, to be able to commit to providing vaccines to 85% of the population in Korea, which is a fantastic plan.
Right. As Dr. Worthel has just said, Professor Shin, initially though, the plan was to secure enough vaccines for more than 30 million people, that is. Is this a sufficient amount, 30 million people vaccinated?
Yeah, so I agree with Dr. Walter. So as I mentioned about, having this high priority for our government for vaccine distribution, 30 million doses will be enough to cover all the high-risk groups in our country, I think. But one thing to remember is that we still don't know how much vaccine coverage will be able to generate the herd immunity over a large population. So we'll have to wait for the evidences from all the phase 3 clinical trials, and we will have to carefully evaluate long-term durations and protective immunity in the future.
Right. Dr. Worthall, officials here are also planning on administering the vaccine starting in the second quarter of next year. Now, keeping in mind safety precautions, that is, when would you believe is the most appropriate time to start public inoculation?
Well, I anticipate quite quickly, right? Once the vaccine is granted with the emergency use authorization by KMFDS in Korea, and of course, once the doses are available in the country, so I don't expect a very long time frame once everything is in place to have the vaccine being deployed in Korea.
Right. Professor Shin, so far we're talking about remarkable advances on the international front with regard to vaccine development. Where does Korea stand with regard to such efforts?
Yeah, so there are several companies that are developing the vaccines for COVID-19. SK Bioscience is one of the front runners. They have the protein-based vaccine platforms. And there are a couple of other bioventure companies that are working on the DNA-based vaccine platforms. But some of them are currently in early phase of clinical trials. But for these vaccines to really go through all the clinical trials and approved by Korean FDA, it will take quite a while.
Right.
I assume. Mm-hmm.
Dr. Worthall, quite a number of leaders have highlighted the importance of ensuring a proper supply of vaccines to developing countries. Now, keeping in mind what we've shared so far in today's studio session, which of the 3 vaccines that we've touched upon do you believe will look to reach the poorest countries the fastest?
Well, as I mentioned earlier on, there are some vaccines that are fully funded by CEPI, and some of them are also part of the COVAX facility initiative. So that is the case for Moderna vaccine. That is also the case for AstraZeneca vaccine. So I believe those vaccines could be implemented in developing countries because our commitment is to be providing the vaccine to developing countries. That's the essence of COVAX facility, right? Not only for Western countries, but also to think of developing countries that there's nobody left behind because no one is safe until everybody is safe.
Right. Do you suppose more can be done to ensure that vaccines are more accessible?
Well, I think it has already been unprecedented to have this global collaboration with different stakeholders, private, public, with pharma industry, biotech companies, with governments, with international organizations. I think the model has worked very well, and somehow I would say CEPI, Gavi, WHO are also engaged in the battle or fight against COVID-19. So I think we have been in a quite new era for pandemic, how to manage a pandemic, and we have now all the systems and collaborations in place to end this pandemic for the first time ever.
Right. Professor Shin, do you believe we'll be able to return to the lives we had before the pandemic once vaccines are widely distributed?
Yeah, well, a vaccine is considered to be the holy grail of ending the pandemic, we know. But I think there are still enormous challenges before us, right? And it'll take quite a while until we can find the normal days we had before. But I really do hope that this day will come again.
Right.
Yeah.
Dr. Worthall, what are your prospects on our lives after the pandemic?
Well, I think we need to remain vigilant. We need to remain committed, to ending this pandemic. Deploying vaccine and vaccination on the ground will take some time because, as mentioned by Professor Shin, we need to prioritize who will be receiving the vaccine first. not the whole country at once. We need to give to some population, high-risk population, and then we go down, from elderly, older adults, and then I would say adolescent that will come later at the very end, once we have more data to show the vaccine works as well in adolescent. So it will take some time, and we need to remain, again, very vigilant and keep all the safety measures that have been mentioned by the current government here in Korea and elsewhere as well, to not ease so quickly all the safety measures, and then we would never control the spread of the virus while implementing mass vaccination in the countries.
Right, and speaking about safety measures, Professor Shin, could you remind us a bit about the safety measures to keep in mind while we eagerly wait for the distribution of vaccines?
Yeah, so until we have the effective vaccines, we should be every day wearing facial mask properly and doing the personal hygienes and keep doing the strict social distancing not to transmit the disease to others.
What are your thoughts about our current social distancing level at level 2? Do you suppose it should be raised, or do you believe it's reasonable to have it at level 2?
Well, given that we are seeing all this, increase in small outbreaks with silent infections, I think we should consider raising the social distancing level to 2.5. And especially, with the Sunung exam is over, so there might be more risk of, gathering, the small gatherings outside. So I think we have to be right. It's very concerning.
Right. Okay, Professor Shin, thank you for your thoughts. And Dr. Worthall, as always, thank you for being with us today.
Thank you. My pleasure.
Right, and on that note, we end this edition of COVID-19. Now, be sure to join us tomorrow for more pandemic coverage. In the meantime, do take care, and thank you for being with us today.